Since when do you use Airseal and how did it influence your work?
We are using Airseal since 3 months in our clinic, and we learned about Airseal from our medical device company DACH Medical Group, and we got really delighted from the very beginning. In complex cases, it really helps to establish the pneumoperitoneum very fast, even when you have to suck. And if, for example, in rectal cancer, if you do preparation in the deep pelvis, the smoke and fog come against the lens, makes it difficult to see exactly the field, the operating field. So with this device, you have an exact, clear view, which makes operating in complex cases much more easier and safe.
What differentiates Airseal comparing it to other devices?
Comparing Airseal to standard insufflation systems, you have a permanent continuous insufflation, you don't have a loss, a lack of pneumoperitoneum, and this makes it much more safe and easy in situations where you have to suck, if it's foggy, smoky, or if it's bloody in the operating field. And secondly, it has a suction filtering the air, including viruses directly in the machine, so there's no contamination in the operating room, which makes it more safe for the surgeon.
What would you say to your colleagues about Airseal?
Well, I would recommend them to use Airseal in difficult and complex operations and also long-lasting laparoscopic procedures, because you have always a perfect view, and to my experience, it makes operations much more safe and of course faster.
How do you see the future of Airseal?
Well, I see a big future for this Airseal system, because we are now at the beginning of thinking about contaminated air in the operating room, and this system protects the surgeon and the whole staff in the operating room. And on the other hand, it's a safe system for operating in laparoscopic procedures. So I would think that this system will be standard in each OR in the near future.
Thank you for the interview, Professor Shamiyeh.
Thank you.
Since when do you use Airseal and how did Airseal influence your work?
Airseal was introduced by my industrial partners a couple of years ago. First I thought it is just another kid on the block for the surgical armamentarium, but this was false. I used Airseal for a tough case at the first time, and I was immediately convinced about the features of the system. The Airseal system allows not only for a clear vision during operation, but also for a sufficient smoke evacuation. This means that this is the only system on the market that is able to filter all these tiny particles, viruses and proteins that are harmful not only to the patient but also to the surgical staff. And we are responsible for the patient and the surgical staff as well. That means the Airseal system gives additional safety to the procedure, but also safety to the surgical staff.
What differentiates Airseal comparing it to other devices?
In laparoscopy, we have two features that are mandatory to have a safe operation. One is the stable pneumoperitoneum. That means the surgeon has a stable field to operate in, even in cases when a little blood suction requires evacuation of carbon dioxide, or if coagulation produces smoke and fog inside the abdomen. In those cases, the safety of the procedure might be compromised by suboptimal optical conditions. Airseal is the only system that can stabilize the pneumoperitoneum with a high pressure inflow, and on the other hand can evacuate the smoke, allowing for a clear vision. You can compare it with driving a fast car on the highway under foggy conditions or under clear weather conditions, and that makes the difference.
What would you say to your colleagues about Airseal?
I would tell my colleagues my own experience. I operated with the Airseal system for the first time on a very demanding, tough patient with lots of comorbidities, cardiopulmonary disease, with an upside-down stomach. So this was a really dangerous case. And my colleagues from the industry, the DACH Medical Group partners, they told me it's a perfect case to use the Airseal system. And they were right. I used it in this case and the patient went perfect. The procedure was safe under low pressure conditions. The anesthesiologist was convinced. The patient went back home within a couple of days without any complaints. And this was so convincing that I now use this system not only in the demanding cases, but in every case that is performed laparoscopically.
How do you see the future of Airseal?
I'm convinced that Airseal has an enormous impact on the future in laparoscopic surgery. It is not the protection of the patient and the protection of the surgical staff. It is the fact that Airseal allows for a new type of procedures that are not manageable without this system. I will give you an example. In cancer surgery, for example, of the lower rectum, we are exploring new approaches from the bottom of the patient upwards, and we know that these approaches will have substantial benefit for the oncological outcome. But all these procedures are not being able to be performed without Airseal system. So that means that Airseal system will have a paramount function in the daily routine, especially in modern, innovative surgical techniques.
Thank you for the interview, Professor Weiss.
You're welcome.